So first, let me start by saying I know that as faculty, we all strive to produce reliable and valid questions, and we've gone through a lot of test construction workshops to learn how to do that. But when it comes to actually being able to map your content to know if you're actually testing all the different contents of the NCLEX-RN test plan, that's become very difficult. I know in the past we've held retreats, and actually with all the faculty in the room have a checklist out that says, okay, which course is teaching chronic renal failure? And then we would go through this big process of trying to map where are all the different areas of content within our program to make sure we didn't have any gaps. Then we would go through and try to make certain that most of our test questions were written at the application and analysis level. But how do you keep up with that? How do you actually know that you're preparing your students the best you can to be successful on the NCLEX? So by using the coding system that is part of the ExamSoft company, it has really made the process so easy. The other thing that I would really encourage you to use your coding for in your categories is the strengths and weaknesses reports that students can be given. After an exam, you can provide a strengths and weakness report to your students, and it'll actually tell you every one of the codes that you have entered into your exam and tell them what are their strengths and weaknesses. And as I go through this, I will point that out and try to explain that into more detail. So let's code to the NCLEX-RN. So what do you want to code and how do you get started? So you want to map content in each of your courses. By mapping content in each course, then at the end you can do a longitudinal report and actually map your content across your entire program. You can see gaps in each course if content's been assigned to them, but you can also see gaps across your entire program. It allows you to identify gaps that are related to the NCLEX-RN content, but it also allows you to identify redundancies within your curriculum. And I know all of our programs are tight, and we keep saying we can't teach anything else, and we don't want to take anything out. That's been a common problem. So you really don't want to reteach the same content. You may want to build on previous content at a higher level, but you do not want to actually reteach content. So you want to identify redundancies. And we have what's called content drift, where that you think, well, if I'm teaching chronic renal failure, let me go ahead and include hemodialysis and peritoneal dialysis. However, those two topics may have already been assigned to another course. So by doing the coding, it really allows you to very quickly see if you have any content drift. The other advantage to coding is it allows you to compare your student outcomes on your exam to standardized exams. For example, if you use Assessment Technology Institute, ITI, if you use HESI, you can look at those assessment exams. They give you how well did your students score, for example, on infection on the standardized exams compared to your teacher-made exams. So those are just some reasons why that you probably want to code to the NCLEX-RN. So let's get ready to map. One of your faculty's best friends is a copy of the NCLEX-RN examination detailed test plan, which you can get free online, and I think I actually provided it for you. Yes, I did on the next slide. When I hire a new faculty member, the first thing I do when I meet with them is provide them with this NCLEX-RN examination detailed test plan, so they know exactly what is on the NCLEX and they can be prepared then for their lectures. And so the next question I ask you is, why is it important to, what do you want to map in your program? You can't map everything. Faculty quickly become overwhelmed, especially if you have new faculty. It does take some time to stop and to map these questions, to put those categories in, but it's valuable once you take the time. And I'm going to show you a quick way to get around some of the time so that it is quicker for your faculty to be able to categorize and map. So then you have to ask yourself, where do you start? Do you only map the 4 main categories of the NCLEX-RN? Or do you include those integrated processes? Do you include Bloom's taxonomy? Do you want to break it down into disease processes so you make sure you are actually testing each of the disease processes you want to make sure you cover? When you start mapping, keep in mind if you want to do a longitudinal review, you can only go back and review what you have mapped. So my suggestion is at least start with the 4 main categories of NCLEX-RN and the integrated processes. The other thing I would encourage you to do is go ahead and add in some disease processes. Whether or not you want to include Bloom's taxonomy will depend on how experienced your test writers are. If they're very experienced, they know how to write those application analysis questions. If they're very new faculty, they tend to either write really, really easy or very difficult questions, and it will help them be able to determine the level of difficulty of all their questions that are on a particular exam. So the NCLEX-RN detailed test plan was effective. This is sort of a review in April of 2016. Here's the link to take you straight to this test plan. Again, it's based on the 2014 RN practice analysis where they actually surveyed new nurses to determine where are they practicing and what are some of the skills that they're performing. And I've heard throughout my career, which has been fairly long as an instructor, don't teach to the test. However, the NCLEX may be the test you may want to teach to, simply because it prepares your student to be a safe practitioner, an entry-level practitioner. So it doesn't necessarily that you teach to the test, but you use it as a foundation. One of the things you want to remember when you're adding your content mapping and your categories, you may want to include cultural and spiritual. It's a brand new content area that was added in, and you should add cultural and spiritual client preference to your assessment and to your plan of care. So you could put this into your clinical courses, which would not show up on your ExamSoft, but it also should be incorporated in some of the questions that you're asking, because it is one of the new integrated processes that you should see threaded throughout your curriculum. This is just an overview of Bloom's taxonomy. Actually, Bloom started in 1956, and it was revised in 2001 from a noun to a verb form. However, NCLEX still refers to the 1956 version. Excuse me. So I've given you these just so you can see the different levels. Excuse me. I think most of you are familiar with the fact that it goes from higher order thinking to lower order thinking. So these are the 4 major client needs content areas or categories that are used in NCLEX, and then there are 2 that have subcategories. Safe and effective care environment has 2 subcategories: management of care and safety and infection control. The second category is health promotion and maintenance. Third category is psychosocial integrity, and the 4th category is physiological integrity. And it actually has 3 categories: basic care and comfort, pharmacology and parental therapies, and psychological adaptation. Excuse me. There are also integrated processes that you must decide whether or not you want to create as categories. These are very fundamental to the practice of nursing. They include the nursing process, caring, communication and documentation, teaching and learning, culture and spirituality. And if you go to that NCLEX-RN test plan that I gave you the link to earlier, each of these are defined on page 5 for you. So when you look at the NCLEX test plan, it actually provides you with the percentage from each of the categories. So when you're looking at your test and you have these categories put in, you probably want to mimic what you see on the screen here. For example, you may want to see more questions related to management of care than you would for basic care and comfort. I provided these with you so you can see there's not a widespread, but some of the biggest ones the biggest one is the management of care. We'll talk more about that in just a minute. Excuse me, too fast. So how do you know how to code your content? If you go back to that NCLEX test plan that I was talking about, for example, on page 6, there is the subcategory management of care. And for new faculty or faculty that are writing a test question and they do not know which part of the NCLEX test plan it would be coded under, they can actually find that under each of these areas are broken down into that NCLEX test plan. So, for example, management of care, some of the questions related to this content area will be advanced directives, delegation, collaboration with the interdisciplinary team, informed consent. And this is just a few. There's many more. But for each of the content areas that's listed on the NCLEX test plan, it gives detailed information about what goes under each of these categories, and this will help your faculty when they begin to code their questions. Let me tell you how we started out coding. We did a very detailed coding program here at the university because we really wanted to make sure that all of our questions fed back into our BSN program outcomes. Part of your accreditation visit will ask, how do you know you evaluate your program outcomes? And this is one way if your faculty actually map back and code back to your BSN program outcomes. So these are just a few of our program outcomes. And remember when I told you it could become very overwhelming for faculty to try to add these codes in? One of the ways you can help them is to use abbreviations. So for program outcomes, if they're coding to program outcomes, we use the abbreviation PO for program outcome. So I listed 4 program outcomes here. And so if they were coding to one of the program outcomes, they would simply type in PO2. And we would know which of the program outcomes they were referring to. Of course, I always give the faculty all of these completely spelled out to read, especially the new faculty who really want to be able to read every bit of the definition and make sure they're coding to the correct outcome. The other thing that we code to are the NCLEX-RN categories that I mentioned. So for the NCLEX code is NX for NCLEX. And there's you'll see the 4 main categories I have there: NX1, safe, effective care environment; NX2, health promotion maintenance; NX3, psychological integrity; and NX4, physiological integrity. And then under each of these, I broke them down and we put like a little A or B. And that way, when the faculty that are coding to one of these NCLEX categories would only have to type in NX2, and we would know that referred to health promotion and maintenance. Another category that we map to or have a category for the integrated processes. One of the things that faculty struggle often with, and I'll show you later one of our reports, is the nursing process. So for the nursing process, we code that as an IP integrated process. Number 1 is the nursing process, and then we break it down into assessment, diagnosis, planning, implementation, and evaluation. This will allow the faculty, after they give an exam and they run the report, to see, well, 75% of my exam was on assessment. I asked 0 questions on evaluation. So students do not have the practice of learning how to answer evaluation questions related to the nursing process. Some courses lend themselves more to particular sections of the nursing process, but your big medical surgical courses, maternal, infant courses, all those should be more widespread across the nursing process. Since the other integrated processes included are IP2, which is caring, IP3, which is communication, documentation, IP4, teaching, learning, and IP5, culture and spirituality. So all of the integrated processes begin with IP. So when I look at these reports, if I see IP, I know I'm looking at an integrated process. We also code to Bloom's taxonomy. Again, new faculty find this very helpful. Oftentimes you'll get an exam back and you'll find out the student scored very poorly on it because it was an extremely difficult exam. If you know ahead of time when you're writing your questions and you're pulling them by the level of difficulty, having them coded to Bloom's taxonomy can be very helpful. So for Bloom's, it's just the B is all we use for Bloom's, and BK is knowledge, BC is comprehension, BAP is application, and BAN is analysis, and we try to keep, even in our early courses, a minimum of 50% at the application and analysis level. So this helps our new faculty know, are they writing their questions at the correct level of difficulty. We also code to our course outcomes. Now, you would only code to the course that you are in at the present time. You wouldn't have to code to all the courses, just your own specific course. So, for example, for Nursing 421, Pathophysiology, I listed 4 of the course outcomes that you will see here. So if I was writing a test question, I would code it to one of the 4 course outcomes. This ensures when students are told, how do I study for this test, and you tell them, look at the course outcomes, they can actually go back and look at the course outcomes. Or if you tell them to look at the course modules, you can actually code even to a more deeper level if you wanted to code to your course, to your module outcomes that you're actually presenting to the students. So all of these, again, have the code CO for course outcomes. The faculty decided we really wanted to be able to use these reports to improve our program, make sure that we have covered all the required content. So we actually code to disease processes. So we sit down in a faculty retreat and we decided how would be the best way to code these where that we could use the information that we received back to know how to better improve our program. Also, these codes the students find particularly helpful. If they get a strengths and weakness report back and it says your strengths are pulmonary and renal, but your weaknesses are cardiac and reproductive, that helps that student know where they need to go back and study, especially when they take those NCLEX prep courses. They know their areas of identified weakness that they can improve on. So all the disease processes are actually labeled DP for disease process. So we did DP integumentary, and we actually abbreviated. So the faculty, when they put in their categories, would type in DP underscore INTEG for integument. For ear, nose, mouth, neck, we use ENT. For cardiac, we simply use CV. Pulmonary, PULM. Musculoskeletal was MSK. Neuro, NEURO. Renal, we spelled out. Gastrointestinal was GI. Repro was just reproductive health was REPRO. So you can see how the faculty themselves only have to type in the codes that you see to the left. When we pull the report, we have a process by which we can look at the code and know exactly what that refers back to for disease processes. Here are some additional disease processes that we actually map or code to. We code to the metabolic or the endocrine system, the hematological system, cancer, end of life, the immune system, which includes infectious diseases, genetics. We actually get into antepartum, intrapartum, postpartum, newborn, and high-risk pregnancy. Our course in leadership said, you know, this sort of leaves me out. We really do not teach disease processes by the time they get to the leadership or management course. That is the capstone course at the end of the curriculum. But there's a lot of things that is covered in that course that we need to make sure is covered. And some of these you'll see are integrated in some of our other roles. But one of them is leadership style, leadership power, management resources, nursing care delivery, communication, legal, ethical, delegation, change, budget, quality improvement. So these are some of the specific categories that we use under the leadership course. That's not to say if another course were to teach some content in delegation, they could definitely pull in this particular coding. For example, in our foundations course, they do an introduction to delegation. They talk about the Nursing Practice Act, and that would actually probably be pulled from this professional role category under the LM_delegation. Our psychiatric mental health course in the BSN program actually asks to have their own DSM classifications. Now this may be more than what you would want to do. However, the reason why they requested this is it allows them to follow what content is being taught to their students in the BSN program. And what we're striving for is a very easy transition from the BSN to the DNP program. So students are used to seeing what are DSM classifications, and we know which ones were taught in the BSN program and which ones need further development in the DNP program. And by looking at the categories, you can easily tell which ones received more time and was covered more extensively in the BSN program, so that you can build on that in the DNP program. And the DNP program uses actually these exact same classifications that we do in the BSN, so it's very easy to look between the two programs and see what has been covered in the BSN versus the DNP. So now you have all your categories, and you think, okay, now what do I do with all these categories? Well, there's a link that I provided you with at the bottom of this slide that you can run many different reports. It provides an in-depth analysis of your learning outcomes. You can actually identify the strengths and weaknesses when you meet with students for their remediation plan, but you can also look at your entire course and identify strengths and weaknesses of your entire course. If you click, you've got to be careful what you click, or you can get a very lengthy report. So make sure you only click the categories that you want reported on, but you can actually select category statistics, and you will get the KR20, the standard deviation, mean, median, minimum, and maximum for your entire exam, or you can run it across the entire program. So again, I've given you the link here where you can go, and it gives you step-by-step instructions on how to run these category reports. So here's an example that I ran for course report for disease processes. This is just one small section for the Pathophysiology Exam 1 this spring for 2017. So if you look at your report, you can see 40 students took this, it said at this particular time. Gives the KR20, the standard deviation, the mean, the median, minimum to maximum, and the total points. But you can see where I actually coded this to disease processes. And the ones that were tested on this particular exam were the immune system or infectious diseases, the introduction to pathophysiology, oncology or cancer, cellular adaptation, which is that DP_cell is cellular adaptation, and stress. When you look at this exam, you can see I really tested heavily on immune system and infectious diseases. There was 23 questions compared to 6, 8, or 7 of the other items. And that you may think, well, you know, that was too many in this particular category. However, I know 3 days were devoted to that particular content area, and there were actually 3 chapters in the textbook that covered that particular content area. So that lets me know that that really is okay. It tells me what % of those questions were answered correctly. So that tells me how well the students understood or grasped the content. They really grasped the content on Introduction to Pathophysiology. Well, that makes sense, since that's mainly vocabulary words. But I can look at this and tell I need to do something to make sure the students have a better understanding on oncology or cancer. So I might look at that and think, okay, do I need to redo the lecture? Do I need to give them some supplemental material? Or what do I need to do? And that way you can actually look at your report and know what do you need to do to improve your course. You can see that it gives you your KR20, and you can see that on the Intro to Pathophysiology I have a negative KR20. So it gives you a lot of detailed reports, statistical analysis for your particular exam. But the nice thing is when you get through, you can run this report for all of your exams that are in that course. This particular course has 3 exams and a final. So when I get through, I'll run the course report with these same categories, and it will tell me across my course how many times did I teach these individual disease processes and how well did the students score, which lets me know when I'm asked, how do you know the students, obtained the necessary student outcomes and learning that you wanted them to achieve. I can look and see that if I say a minimum score, percent correct is 75%, I was able to meet all those. This particular report, I looked at the nursing process. So you can see that on this particular exam, for assessment, I had 14 items. For diagnosis, I had 15. Planning 6, implementation 2, and evaluation 15. And when you think about pathophysiology, implementation is not a big part of pathophysiology. That's more your med-surg courses and the courses that come after pathophysiology, so you kind of expect that. But it does tell me that I may need to include more questions on planning. You're taking care of the patient with a particular disease process. What diagnostic test might you plan for? So I may need to include more of those. Again, it gave me the percent correct and incorrect, and then all my statistics. So I looked at NX4, and if you remember, that's NCLEX-4 across the program, and NX4 is the physiological integrity, and it's broken down into those 4 subcategories of basic care, comfort, pharmacology, parental therapy, reduction of potential risk factors, and then psychological adaptation. And what you see here is how many questions I have on each of those different categories across the program that I looked at. So this is just a snapshot of how well are we actually covering that particular component of the NCLEX-RN test plan. So this just gives you a big overview of that. And you can see where we need more, definitely under psychological integrity, and where we really have a lot, which is physiological adaptation. So when we meet as a faculty and look at this, we'll talk about where that psychological integrity needs to be added, and where we could have additional opportunities for the students to have an opportunity to learn that content. So that is the end of my presentation. We have started using these reports extensively to not only improve our program, but also our student outcomes and student learning outcomes. Faculty sit together, they look at these reports in detail, and we actually spend our retreat time looking at these to see where do we need to improve and where have we done a really nice job. And faculty really appreciate having some detail so that they really know where to revise their course and what they need to do. So I'm ready, Stephanie, for questions if you are.
Fantastic. Thank you so much, Tommie. Great presentation. So we're going to go ahead and open up the floor for Q&A session at this point. If you have questions for Dr. Norris, now is the time to pose them in the questions area of the GoToWebinar control panel, which is on the right-hand side of your screen. If you type them in the questions area, I can read them aloud and give Dr. Norris an opportunity to respond. We have a couple that have come in already. Tommie, is it all right if I go ahead and just jump in?
Sure.
Fantastic. Okay, the first one is, are you sharing any of this performance information with the students, and if so, how often?
Yes, we do actually share with our students. After an exam is given, the students are allowed to review their tests. ExamSoft has the feature where immediately after the exam, the students are allowed to review their particular exam, their answers. And what I try to do is the next time we have a class, I spend the first few minutes talking about the exam that was just given. I provide them with, and I hope I'm answering your question, the minimum to the maximum score, what was the mean, and we also talk about highly missed questions, and I ask them what was confusing about a particular question. But when the students who do not make 75 it's required that they come and talk to the faculty for a plan for remediation. And one of the things I share with them is their strengths and weakness report. And it actually provides them with all the different categories. It tells them what disease process they had strengths or weaknesses in, and also which part of the nursing process they need help on, or they need to remediate more on. So the students have said it provides them with a lot of excellent opportunity. Now, that strength and weaknesses report could actually give them the entire question, all the options, all the rationale, or you can tell it, don't provide it with the question, just provide it with those categories, and that way the student can take it with them. We encourage them to put them in their portfolio, and then when they get to the end of the program and they're doing their NCLEX review, to pull those out and look at their strengths and weaknesses.
Wonderful. Thanks so much. Next question is, how long has this process been in place for you, and have you seen any measurable results specifically on NCLEX pass rates?
Well, it's been in place we have been one of the early ExamSoft users, but we've actually been using the categories in the BSN program for the past 3 years, and we've had a 100% pass rate for the last 3 years since we've reopened the BSN program.
Fantastic. That's impressive. Next question is it possible to utilize this process for the assessment in clinical settings or performances as well?
Absolutely. If you have some way to measure it so that you can put it into ExamSoft and ask them questions. And if you go into ExamSoft, there's opportunities for open-ended discussion questions. There's different types of evaluations that are available. So absolutely, you could put some things related to clinical into ExamSoft and be able to evaluate those. You just have to decide based on that, do you want to use those same categories I provided, or do you want to come up with specific categories that are more relevant to the clinical setting? There's one program I know that they actually, for the clinical courses, actually code to the different skills that the students use, and they code to those, and then when they get through they can look and see as the students perform skills, it's put into the system, and they can actually determine how many students had an opportunity to do Foley catheter insertion and all in different skills. So that is another thing you could look at.
Great, thank you. Next question is, how many categories can you assign to a single question or item?
There's no limit. The limit is faculty fatigue. It does take a lot of time, especially when you're a new faculty member and you're not used to writing test questions, to put these codes in. So that was, early on I talked about how many things do you want to code to. Think about what's critical for you to code to. A lot of programs that I consult with when I do curriculum revision or curriculum redesign, when they're having difficulty with either student learning outcomes or retention or perhaps their NCLEX test rate, as I tell them, probably the most critical things, if you've got to start somewhere, are your NCLEX categories, the integrated processes, and pick out particularly some of the disease processes that go across your curriculum. That gives you a snapshot of how well you're preparing your students for NCLEX. You can almost determine Bloom's taxonomy by doing a check mark beside each question. If you don't want to actually have it as a separate code, faculty would have to map to. And a lot of programs map separately to their BSN program outcomes on a separate form, rather than trying to do it with each test question, because you meet your BSN program outcomes through many ways other than just through your exam questions.
Great. Okay. Looks like last question, unless we have anything else come in. Who is deciding what categories to use and with what questions? Is it faculty?
Faculty. We sat down at our faculty retreat, and we decided what was essential for us to map to and what would be nice to map to. And it was really interesting. I proposed that we only map to the NCLEX categories, the integrated processes, and the disease processes. From there, you saw where the psych mental health course requested to map specifically to the DSM codes, and then the faculty also said they really wanted to map to Bloom's taxonomy for each question. So the best way to get, to vet is to vet it with your faculty and say what is really important for us to be able to report on and know that we have a quality program. And those are probably the minimum. And it doesn't really take long if you use some type of abbreviation where they're not having to type out all these things, and they can just put in those abbreviations like NX4.
Wonderful. Thank you so much, Dr. Norris. We're going to go ahead and wrap everything up there. Thank you so much for your attendance this afternoon. I know it's a very busy time of year. Everybody has a lot going on, so we appreciate you taking time out of what I know is a very busy schedule to present this topic, Tommie, as well as to all of our attendees for being here. Just a quick reminder, when you do close out, you will get a pop-up that will have a link to a very quick survey. It's only 5 questions long. We would really appreciate you taking just a couple of seconds to fill that out, so that we can continue to provide relevant content with these webinars. Also, this presentation has been recorded. Everybody will receive a link to the recording within the next 24 to 48 hours. Please check your inboxes for those, and feel free to share as you would like. Again, thank you so much for your attendance today, and we'll see you next time. Thank you.